A bundle of joy and pride for every woman who experiences pregnancy. But in many traditional Ghanaian societies, this visitor is not considered a human being until 7 days later. That is when the pomp and pageantry by family members near and far begins, and rituals are performed to give the newest addition to the family a name by which he or she can be identified. Whereas the first 7 days are essential to ensuring these new arrivals are counted among the human race, medical practitioners say they sometimes have less than a week to prove they are even fit to go through these rituals.
When we look at the deaths that occur in the first 28 days, 50% occur on day 1, the first 24 hours. 75% will occur in the first week. On day 1, 50% because, the problems with breathing, they don't need a length of time to kill. So some of them will occur within hours. Before the child has any chance of, being named, 1 week, 75% of them are dying. For that reason, we are placing a lot of emphasis on postnatal care. And the recommendation is for every mother and baby to be seen at least 2 times in the first week alone.
The United Nations Millennium Development Goal 4 seeks to reduce by 2/3 the mortality rate of children under 5. But the battle to keep these babies alive much longer appears far from over.
When we look at all deaths that occur in children under 5 years old, we've made some progress in reducing those deaths overall. If you look at the overall under 5, overall under 1, we've made progress, but the picture changes when it comes to newborn health. For the newborns over a number of about 2 decades, we haven't really progressed in reducing their deaths. We've been hovering around 30 deaths out of 1,000. And currently, the latest figures we have from 2011 give us 32 deaths out of 1,000 live births. So it means that of 1,000 babies that are born alive, 32 of them are likely to die before they are 1 month old. That's a huge figure. Yeah. If you compute that roughly for the 2013 figures, it comes to about 26,000 newborn deaths just in that year.
So what really accounts for these deaths in the newborns?
Okay, there are 3 major causes mainly that are responsible for these deaths. The first is breathing difficulties around the time of delivery. Technically, these are called birth asphyxia. Secondly, infections. And then thirdly, prematurity.
It is estimated that newborn deaths in Ghana account for about 40% of deaths in children under 5 years. Whereas some of these factors can be attributed to natural events, there is still hope of preventing newborns from dying in large numbers. In the central regional town of Breman Asikuma, for instance, mothers are being introduced to simple ways of ensuring their babies survive not only the first 28 days of their lives, but also live well beyond the age of 5.
Would the one and assessors and could see a buying it way. And what the woman for saying and Trinamino. Now, what did we are no way dear Kutu? And I brought free, and I said, could do. I brought baby, a piano, no one did the account, and your friend Sabalans died. And yes, I has a quarter, and Nantrinam, I could call them like baby. nti sa wotimi ya sa de nyina wo ba wo afa ba asundwe mu na mo fa ne pempin so se ya wo fi a ba ma me fo no obi wo no ma oni ahoma a wo de kyekere furuma no nti e bia ma me na oje wa wo no wabo ne ti osane ahoma na apɛ na o de akyekere furuma no efi wa ahoma no ho wa nti bo o de kyekere furuma na apɛ bo nza ma yareba akora no mu
ajo fa mfati wako bache
Pasha be juma ne
ajo me sim stress
into when you say waiting how many months
bacho only the me wo me ben my na chi message nti me nche de nyi man kisa bacho ba hospital no maka da afi no my 8 months on na me de my bacho
it started at a hospital. How about in the so far?
Bacho, ye no muka de. I attempts yenya exercise. And upon ya and fire na intiti musia budun kaganga. Na fi to say ye na tataya. I da yan fire 18 and 9 angu sunido. Kakra mi wa me kache mi nuanem de se omo ko hospital no mo aduru na omo no na aduru eye pa na afiso omo de wo omo sikru mo friend bi wo ho ma bo na bo friend obo man bo so ni se ba ko de ma bo na afi abo friend na so na de na aha ni ti se omo man do a omo si nso akula na mi ne de wo omo si be man afriend so enufo ha mo ko ye ko ba ko omo kire de so o ma bo friend fu ma bo friend ni yefun enka we yefun na fa won sa ba kon tai when afran when fu na sa manana no antare ni we ebituma atare ni hwa no man so di sunsan de bia brain.
Thanks to support from non-governmental organizations like Project 5 Alive, pregnant women no longer have to struggle with access to healthcare facilities due to a special transport arrangement.
Isaac and cancer.
Okay, now, NF 5 Alive for started or you juma bed if you are in.
My normal started a fickle nefan. A jumano de Metuma was a metuma abom. Because I pay for no woman who had a number one which one pie ye a wakam. Timetim was at them anytime you're made and befriend me to my boy.
More putting Ben out the mom.
And one of the mom sometimes so be any time in soon on my way. Ya. Between me, semi who and Nasa be a hana, between kinds on the umbrella clinic with the home of him. The lady demon and neck women and M1. I will now win. I'm a 1 million.
Okay. Now, into a friend saying, I pay for a or more than normal contact. Only hospital no see you, man. I say, a man is saying, I'll mutime it almost said to make out.
Okay, ya honey villages will be brave. Into village no boa me kwa. Woman hear me, a woman Jimmy Noma, no man no matter one. Until any time your befriend be me to me call a coffee never. Na clinic as my jammy no more. Until any case be a woman here, I win here ambulance in the hour from me to me by phone. I don't know.
The work being done by Project 5 Alive in Breman Asikuma is not limited to educating only mothers and providing transport for them, but traditional birth attendants such as Elizabeth Isiedu and her mother are also benefiting from the project. TBA Jumana and if you
Mammy, or Chem de so be back, never son now, and me so ya me whom suit and time be war a bad name. Tede, Mreno, and sing. Nemo me who need them there, and then ask, and then some gross, namin crochet, no bell boko. No be so bad, Nessa or Cotemte in Sugun. But on 10 I see a yell be a lancia, and so be catching us when the man of uncle. Hospital, or Bana Onyam cannot transfer man, mamma, and so or deco. Will be back now, say, be a nitty. No sending arm in my massia. Nan can't penny from where drew. na mka kyerɛ sɛ yɛkɔ course no wɔyɛ da obi wɔ hɔ ne tripa na ɔnyema ma me mana ɔnhwɛ no wɔ fie nti sɛ wowɔ abidu kora a sɛ this time yɛsan yɛde kɔ hospital nti ma me sɛ ɔte ase sɛ kyerɛ sɛ nansi ntum nkɔ course meeting na ade nti sɛ ma na me kɔ no ma bɛka saa ade a ɔmana yɛde kɔ obi so ba mo hu sɛ ɔsɛ ne so kyin na ade nya yɛde kɔ hospital.
In spite of these interventions, there are still challenges that need to be addressed, such as access to healthcare facilities. The road connecting Jamra to communities such as Kawanopado and Adandan are in a terrible condition, and this is claiming the lives of both babies and mothers. Daniel Kwashi knows too well the cost of living in Adandan.
2 years in it.
2 years. Okay. About the potency.
Now I had nature. I don't know. No, just say I'm na yeah for the call yet now call a hospital was coming into your corner. Carno now riding or canning yet into carne tie palm pen me or quem. Nti I and do jam nampo. O send or pay ara. Obuguha be 1 hour. No we tie nation. O can so conclude na tie na pie. Sa na upper and payment no. The last one no or shall na be no the film. Into Sana something.
Into no about time. Or you are brand than
no, non crowd kunundu meno anapa.
The Ghana Health Service is meanwhile advising mothers to follow the advice given them at the antenatal and postnatal sessions. For now, one can only hope the Project 5 Alive GHS collaboration will have a trickle-down effect so that the incidence of newborn deaths will reduce, especially with cases that are preventable.